Hi, I'm Jyotishwar. I'm a Master of Science and Applied Computing student.
Hi, I'm Wu Yue. I'm ECG department.
Hi, and I'm Soha, and I'm a Master of Pharmaceutical Science student and a pharmacist at a cancer center. So we're ChemoBrain, and the motivation for our app comes from when I work in a cancer center pharmacy. The one I work at actually has a special callback program. So a pharmacist will call a patient a few days after the first time they get their chemo just to see how everything is going. Too often, I end up on the phone with a patient who's been suffering from a side effect needlessly. If they had known to either call us ahead of time so that we can actually help them, or if they had been given the tools to take care of themselves better, they wouldn't be suffering from the side effect that they're experiencing. The other really big thing to consider is that something as simple as constipation or diarrhea can actually escalate in these patients to the point that, for instance, diarrhea can cause severe dehydration, so they end up hospitalized, or constipation can result in a bowel obstruction that would require surgical intervention. The other really big problem is that symptom tracking is really annoying. It's really annoying to have to write everything down that's happening to you, especially when you're not feeling well. But it's something that's really important for healthcare providers, that we actually know how to take care of people. So what our app does is help patients track their side effects, so in this case constipation and diarrhea, passively, so that it requires as little intervention from the patient as possible.
So the overall design of our application, the user first enter the basic information, the demographics and the type of medication they are taking. So we populate a scoring system to understand their baseline risk of having constipation or diarrhea, and all this stored into the database. And then they interface a sensor tag with them and place it in the washroom, and then they can start going to the washroom per normal, and the application passively tracks the different bowel movements. And all this information is used by the identification engines to find out whether the patient is suffering from either diarrhea or constipation, and also ask some questions to identify the severity, and if the issue is detected, the application notifies them and also provides them some advice to take care of themselves. And if the case is severe enough, then the application pushes all this information into a web server, which the healthcare provider can access and view all the information that has been tracked by the application.
Okay, so now we're just going to go into the demo. So the first thing a user would do is log in. So I'm just going to wait for it to log in. And the first time that a patient would use the app, they would actually complete their profile. So for this, in this case, we're going to meet Jane Doe. She's a 70-year-old female. She also has 2 bowel movements every day normally. She has had constipation in the last 3 months. She's been diagnosed with rectal cancer. In terms of other side conditions, she has high cholesterol. She's been taking Senecot to take care of her constipation so far. In terms of chemotherapy, she's getting capecitabine, and she does not have an ostomy. I'm just getting a little bit ahead of you, sorry. So now we're just going to register. So this is the patient's main page, and the next thing that they're going to do is actually connect to the sensor tag. And the purpose of the sensor tag is to track the number of washroom visits that a patient would have. So and this is just for the purpose of demonstration, because everything is going to be done passively, but because we have to show you what the app does, we're just going to simulate it. So we have connected the sensor tag, and the sensor tag is based on distance. So we're actually moving the sensor tag as far away from the app as possible, so that we will kind of end a washroom visit. And we're just going to see that we actually are tracking distance and the duration of a washroom visit. So once that's...
Yep, now we're simulating different bowel movements.
Yeah, so, and we're additionally going to simulate a few extra bowel movements just because we want to show a case of diarrhea, because the app will actually do something when they detect that you have diarrhea.
Okay.
So we're going to pretend that all of that happened because someone's actually going to the washroom. And just as an aside, the app also gives patients information about constipation and diarrhea and how to manage it kind of at baseline, because there's a lot of confusion with patients and healthcare providers about what we consider actually being an issue and what is actually constipation and diarrhea. So we can just see there's constipation information that patients can access, and then also diarrhea information that they can access. Now what we see is there's a notification that there are bathroom visits that have been tracked from the sensor tag that need to be confirmed in terms of which one of them are actually bowel movements, because every time you go to the washroom is not a bowel movement. You can go to the washroom to brush your teeth, for example. So we see that we have all of the bathroom visits that a patient has tracked, and the patient would have to check mark the ones that are actually bowel movements and confirm them. And then once that happens, there's going to be questions that they're going to have to answer. So we're going to have to answer a couple quick questions, so like consistency and color of the bowel movement, and then we're going to submit those answers. And then we're just going to see that there's a notification that there's a problem. So this patient is going to have to, they get an alert, so when they click on it, they're going to see that they have some personalized advice, and they know that they should be contacting their healthcare provider because they have a severe case of diarrhea because they just went to the bathroom like 7 times in a minute. So obviously there's an issue. The other thing that the app contains, can we just go back to the app quickly? Are charts. And the charts are just going to show the number of bowel movements the patient has over time. Because we just installed the app today to display it to you guys, we see that there's only 1 bar in the chart. But over time, people will be able to see trends. Now, because every time a patient has a severe case of constipation or diarrhea, it gets pushed to the server. So we're going to go to the web browser, and this would be for the health provider to be able to log in and see all of the patients that actually have a severe case of constipation and diarrhea. And so this would facilitate information transmission so that we actually would know what's happening to a patient without them having to list and read everything off the phone for themselves. So we see that Jane Doe has actually been pushed to the server. Can you see that?
No, the application detected that Jane Doe has mild diarrhea, so in this case, Jane Doe has not been pushed to the server. But for example, if we have a patient like Steve Smith, he has been detected with diarrhea. So if we click on Steve Smith information, we find that he is suffering from diarrhea and is 48 years, and the type of brain cancer he's suffering from, and also the different kind of, in the end you can see the different bowel movements that the application has tracked over the period of time. So for key learning, we found that translating all the soft clinical knowledge to hard rules is difficult, and we would have ideally liked to adjust the scoring system with additional user information before we finalize that. And our algorithm currently only takes into account the Bluetooth data, but we would have liked to build the algorithm such a way that it can also take in additional sensory information such as the temperature and others.
So for the future work on the mobile app side, so we can connect multiple sensor tags and then to get a different sensor data, for example, temperature. And then on the web side, we can have a clinic note. So for example, when a nurse talks to the patient over the phone, so they have to document the conversation. So if the clinic notes allows them to put the notes on the web server, so they can have a summary which patient they actually been talked to, and then we can push the notes to the mobile app, so they will have a summary of the conversation, and then they can take care of themselves better. That's it.
Thank you.
That's great. It's good. It was a really good introduction as well. Just a quick comment. You were talking about the sensor tag, but you never actually explained it. You just assumed we knew what it was.
Right.
And you should say the sensor tells us whether someone has gone to the bathroom or not. And it's,
right.
Yeah, kind of. It's important to say that. Any quick questions before we finish? Great. Okay. Thank you.